Hello and welcome to the BBJ's inaugural Leaders in Healthcare event. I'm Rhonda Pringle, Market President and Publisher of the Baltimore Business Journal. We're grateful that you've joined us this morning to help us recognize this year's leaders in healthcare. When we decided last summer that we wanted to honor those that are making a positive impact on Greater Baltimore's healthcare industry, we could not have had the appreciation that we have today for what it takes to be a true leader in healthcare. What we found when we read the nominations are leaders willing to embrace new ideas, new technology, and unafraid to shake up the status quo. It was our intention when we started to select 7 honorees, but given the number of outstanding nominations, it soon became clear that 7 was not enough. And so this morning we were pleased to honor 17 outstanding leaders in healthcare. During today's program, we were joined by the BBJ's healthcare reporter, Morgan Eichenseer. She talks with a few of our honorees about what changes the healthcare industry is making and how they're addressing some of the challenges during the current pandemic. Before we get started, I would like to thank premier sponsor RCM&D, partner sponsor Cascon, awards partner Allogram, contributing sponsors Capital Concierge and Duck Pen. Please feel free to use the shout outs via our question panel in order to show your support of our honorees. And don't forget to use hashtag BaltBizEvents on any social media posts congratulating your favorite leaders in healthcare honorees. Our premier sponsor, RCM&D, is ranked among the top privately held insurance advisory firms in the United States and have a dedicated professional practice specific to the healthcare industry that provides strategic solutions and consultations for risk management, insurance, and employee benefits. Here to introduce this year's incredible honorees is RCM&D's healthcare practice leader, Kevin Carnell. Kevin.
Good afternoon and welcome to the 2020 Baltimore Business Journal Leaders in Healthcare Awards. For over 135 years, RCM&D has been proud to call the Baltimore area home. We are one of the largest independent insurance advisory firms in the country, with the ultimate goal of being a partner our clients can trust. Our dedicated healthcare practice has been working with healthcare organizations across the region for over 70 years. We are proud to be with you today as the premier sponsor for this event. As we are all well aware, we have faced remarkably unprecedented challenges in the past 12 months fighting the coronavirus. When we look back at 2020 in the history books, we will never forget the adversity and hardships. However, we will also remember the countless examples of strength, courage, and perseverance displayed by those in the healthcare community. All who will be recognized today are to be commended for the work they do every day, and especially in today's world. My colleagues at RCM&D and I extend our congratulations to all the honorees for this well-deserved achievement. You all make a tremendous positive impact on our community, and we are grateful for your efforts. Thank you to the Baltimore Business Journal for hosting this event, and thank you all for joining us as we honor our region's leaders in healthcare. In the healthcare education category, she has led the city's public health education efforts during the COVID-19 crisis, including regular briefings on the importance of social distancing and wearing of masks, and communicated important statistics to the people of Baltimore as the pandemic has progressed. Congratulations to Dr. Letitia Disraza, Baltimore Health Commissioner.
Thank you, Baltimore Business Journal, for honoring me as the 2020 Leader in Healthcare. I want to dedicate this award to the men and women who work hard at the Baltimore City Health Department, keeping the residents of Baltimore City safe. They've sacrificed so much time away from their family, their friends, and their loved ones to be a part of this important effort that protects the health of the residents here in Baltimore City. They are my daily inspiration, and I would not be getting this award if it weren't for them. Thank you.
Her school has continued educating a new generation of nurses for Maryland and helped meet staffing needs for the state's medical system by allowing qualified, trained nursing students to work in hospitals to help address a surge in COVID-19 patients. Congratulations to the Dean of the University of Maryland School of Nursing, Jane M. Kirschling.
Thank you for this award as a leader in healthcare. The University of Maryland School of Nursing faculty, staff, and students have shown amazing resilience during COVID-19. and we continue to produce excellent nurses for the workforce. We are forever grateful for this recognition. Again, thank you.
In the medical cannabis category, with a holistic wellness model that promises mental health and healthy eating in addition to dispensing cannabis, he is CEO of the only medical cannabis dispensary of its kind on the Eastern Shore. Congratulations to Anthony Darby, CEO of Peninsula Alternative Health.
Wow, what an honor to be recognized by the Baltimore Business Journal as a leader in healthcare. It means a lot. I want to thank the Baltimore Business Journal, those who nominated me, and the staff that I work with day in and day out for helping me achieve this award. To everyone else that was recognized by the Baltimore Business Journal as well, shout out to you guys as well. I'm really glad to be helping medical cannabis in Maryland move forward every single day. Thank you guys for recognizing me.
Both of these women have led the launch of the nation's first medical cannabis science graduate degree program right here in Baltimore. Congratulations to Leah Serra, Associate Professor and Director of the Master of Science in Medical Cannabis Science and Therapeutics, and Natalie Eddington, Dean, University of Maryland School of Pharmacy.
Hello, I'm Leah Serra, Associate Professor at the University of Maryland School of Pharmacy and Director of our Master of Science in Medical Cannabis Science and Therapeutics program. I'd like to thank Michelle Wright, a student in our inaugural cohort, for nominating me, and the Baltimore Business Journal for honoring me with this award. Additionally, the development and implementation of the nation's first master's degree in medical cannabis couldn't have been accomplished without the support of many, including Natalie Eddington, Dean of the School of Pharmacy, our program manager, Lisa Finn, our excellent program faculty, and of course, our trailblazing students. Thank you.
In the healthcare executive hospital category, he's been the leader of the Greater Baltimore Medical Center healthcare system since 2010 as its president and CEO. He's led with an approach of promoting preventative health care to keep people healthier and out of the hospital, while also deepening GBMC's community ties in Baltimore. Congratulations to Dr. John B. Chassar, President and CEO, Greater Baltimore Medical Center.
I want to thank the Baltimore Business Journal for this wonderful award. The entire GBMC healthcare system has been working hard, even during the pandemic, to move us closer to our vision of being the community-based system of care that can deliver to every patient every time the care that we would want for our own loved ones.
In the healthcare executive non-hospital category, President and CEO of the Maryland Hospital Association, which advocates for all the 61 hospitals and healthcare systems in the state and has continued to do so for staffing, personal protective equipment, and the other needs during the pandemic. Congratulations to Bob Atlas, President and CEO, Maryland Hospital Association.
Thank you, BBJ, for this honor. I've been dedicated to advancing healthcare my whole working life, and this recognition really means a lot. Right now, though, with COVID-19 surging across Maryland and the nation, I want to say how grateful I am to all our hospital teams, the frontline caregivers, and everyone who makes their life-saving work possible. To those heroes especially, my deepest thanks.
He has helped grow HealthWorx since its launch and steered investments into new tools to help the insurers, members, and providers amid COVID-19. Congratulations to Ricardo Johnson, Vice President of HealthWorx, CareFirst, BlueCross, BlueShield.
I want to say thank you to the BBJ for this important and timely recognition. I appreciate the kind words that were shared, but what really matters is that through the work that HealthWorx is doing, we're able to make progress in creating a better and more equitable healthcare experience. I couldn't do this work without the effort and support of an amazing team at HealthWorx, and so I want to thank them immensely. And also want to specifically thank one of the leaders that inspires me, the CEO of CareFirst, BlueCross, BlueShield, Brian Pennick, whose vision for healthcare in this region constantly motivates me to reach farther. Few times have seen a greater need for leadership in healthcare in our city and in our country. And so I want to give my gratitude to the incredible leaders who are also being honored, because in order to improve healthcare and the health of our communities, we must do this together. Thank you.
In the healthcare innovation category, co-founders of ClearMask, a Baltimore-based startup that has developed an FDA-cleared, entirely transparent surgical mask designed to improve communication between patients and surgeons. Congratulations to Elisa Dittmar, President, ClearMask, and Aaron Shu, CEO, ClearMask.
Hello. We are truly honored to receive the first ever Leaders in Healthcare Innovation Award. We would like to thank you all for this incredible recognition and thank our friends, families, colleagues, community, and all those who have supported us these past couple of years. We would not be here today without your support. We look forward to many more great things to come with the ClearMask as we continue to break down barriers and make a clear difference for all. Thank you.
The Chief Medical Information Officer for LifeBridge Health and Medical Director of LifeBridge Health Virtual Hospital, he has led the system's charge this year to ramp up telemedicine, which has promoted access to healthcare while keeping LifeBridge staff and facilities focused on COVID-19 cases. Congratulations to Dr. Jonathan Thierman, Physician, Executive, and President of the Medical Staff for Northwest Hospital, LifeBridge Health.
Thank you to the Baltimore Business Journal for this honor. I'm grateful and humbled by the recognition of the Baltimore Business Journal and the Baltimore community for all of the hard work we've done at LifeBridge Health. I'd like to thank Neil Meltzer, our CEO, and Tressa Springman, our CIO, for their support. I'd like to thank the core team at the virtual hospital, John Moles, Rennie, Yaffa, Christy, Shannon Smith, all of whom have made this possible. I'd also like to thank our team in Israel who supports us remotely, as well as our lab led by Dr. Malavi and Donna, and our registration folks led by Kelly Hawkins. Finally, our innovation team led by Dr. Dan Duran and Potik and Adam Beck. I would like to thank all of the members of the LifeBridge community who I have not mentioned, who've worked so hard to make our response to COVID-19 a thorough and responsive effort. Finally, I'd like to thank my family, Melanie, my wife, and my kids, Jake, Ben, and Maya, for their support during long and stressful days over the last many months. I make a pledge to the Baltimore community from LifeBridge Health that we will continue to innovate and strive for better health and outcomes for our communities. Thank you again, Baltimore and the Baltimore Business Journal.
Healthcare outcomes category. He's worked to help connect Spanish-speaking providers at Hopkins with patients admitted to the hospital for COVID-19, improving care for our vulnerable community here in Baltimore. Congratulations to Dr. Santiago Alvarez, Fellow in Allergy and Clinical Immunology, Johns Hopkins Medicine.
Hi, this is Santiago Alvarez. Thank you very much for this award. It is an honor to be part of this group of leaders in healthcare that are committed to patient care and make an impact in our community. Thank you.
This year, he has helped start up Shepherd Pratt's virtual crisis walk-in clinic, which provides psychiatric triage and referrals for patients in need of urgent mental health care via telemedicine. Congratulations to Dr. Deepak Prabhakar, Medical Director of Outpatient Services, Shepherd Pratt Health System.
Hello, I'm Deepak Prabhakar, Medical Director of Outpatient Services at Shepherd Pratt. I'm honored to be recognized by Baltimore Business Journal for its Leaders in Healthcare Awards. 2020 has been a year like no other. I'm proud to be recognized alongside my fellow healthcare colleagues who are working tirelessly each day to educate, support, and heal in the midst of this pandemic. I'm especially proud of what we have accomplished at Shepherd Pratt. In particular, the work we have done through our virtual crisis walk-in clinic to create greater access to urgent mental health care. I would like to thank all of my colleagues and the leadership team at Shepherd Pratt for their ongoing work and support. Once again, thank you to the BBJ and congratulations to all my fellow honorees.
She manages a portfolio of grants, sponsorships, and donations for Kaiser in the Baltimore area and has focused her work in part on addressing community members' socioeconomic and health needs in disadvantaged areas. Congratulations, Alma Roberts, Interim Director, Community Health and Economic Opportunity, Kaiser Permanente.
I want to thank the Baltimore Business Journal for recognizing me as one of their healthcare leaders. I also want to thank the leadership of Kaiser Permanente and all my colleagues in community health for allowing me to be part of the enormous scope of work we do in communities throughout this region. Finally, I want to thank my family, especially my dynamic sisters who've served as role models throughout my career. Thank you all.
Alma Roberts, we all know how much you love Baltimore, and now we know how much Baltimore loves you. We are so proud of you and so happy for you receiving this award. You are well deserving. We want to thank you for all that you do to dedicate yourself to improving lives in Baltimore, and we want to appreciate you and tell you congratulations from all your friends at Kaiser Permanente.
Under her leadership, the organization this year began offering gender-affirming care for Maryland's transgender and non-binary community to meet a need for such therapies. Congratulations to Dr. Seema Shah, Associate Medical Director, Planned Parenthood of Maryland.
My name is Dr. Seema Shah. My pronouns are she, her. It's an honor to receive this award for my work to start gender-affirming care at Planned Parenthood of Maryland. Thanks to Dr. Reagan McDonald-Mosley, CMO, and Shirley Terranova, VP of Development, for the nomination. My community collaborators, Deb Dunn at Chase Bruxton and Lee Blender at Trans Maryland. The PPM project team, our Easton and Frederick staff for being our starting sites, and big shout out to Tika Torres, our care coordinator. Thanks again, BBJ, for the recognition to improve access to gender-affirming care.
Our last category is senior care. President of the Health Facilities Association of Maryland, a trade association that advocates for the state's skilled nursing and rehabilitation centers, assisted living campuses, and other enterprises serving Maryland's vulnerable senior population during the pandemic. Congratulations to Joseph DeMatos, President, Health Facilities Association of Maryland.
Baltimore Business Journal. Joe D'Amatos here with the Health Facilities Association of Maryland. On behalf of the tens of thousands of healthcare heroes and the many tens of thousands of Marylanders in need in their care, we humbly accept this honor. Thank you.
The Maryland Baptist Aged Home in West Baltimore made headlines this year for avoiding any COVID-19 cases during the spring, thanks to its careful infection prevention and other safety measures to protect elderly residents. Congratulations to Reverend Derek DeWitt, Director, Maryland Baptist Aged Home.
Hi, I'm Dr. Derek DeWitt, and I am honored and humbled to accept the Health and Leadership Award from the Baltimore Business Journal. On behalf of the employees, the residents, the families, and our parent organization, the United Baptist Missionary Convention, I thank the Baltimore Business Journal for recognizing the extraordinary accomplishments of our staff to keep the Maryland Baptist Aged Home COVID-free. We are extremely appreciative of all of the recognition from around the country, and we thank the Baltimore Business Journal for giving us this great award. Thanks again, and God bless.
Congratulations again to all the honorees. Back to you, Rhonda.
Thank you, Kevin and RCM&D, for your support for leaders in healthcare, and congratulations again to all of our honorees. We thank you all for the great things you are doing for the healthcare industry in Greater Baltimore. You'll learn more about our honorees in tomorrow's December 4th issue of the Baltimore Business Journal. And now I'll turn it over to the BBJ's healthcare reporter, Morgan Eichenseer, as she sits down for a healthcare discussion with a few of our honorees. Morgan.
Thank you, Rhonda. This year has definitely been one worthy of many accolades for our healthcare workers and those who help ensure that they can do their jobs. It has been an especially exciting and interesting year to be covering the healthcare beat. This industry is always evolving, but especially during the pandemic, we've seen bigger and faster shifts in healthcare and how it's delivered than ever before. We've got some great folks joining me to talk about some of those changes, so I'll go ahead and introduce our panel. Joining us today, we have Anthony Darby, CEO of Peninsula Alternative Health.
Thank you for having me today, Morgan.
Hi, Anthony. Next, filling in for honoree Ricardo Johnson is Michael Batista, Director of Commercialization for HealthWorx at CareFirst BlueCross BlueShield.
Thank you. Good to be here.
We also have the Dean of the University of Maryland School of Nursing, Jane Kirschling.
Thank you for this opportunity, Morgan.
And finally, we have Dr. Jonathan Thierman, Chief Medical Information Officer at LifeBridge Health.
Hi, thanks for having me.
Thanks everyone for joining me today. We have a lot to talk about, so we'll jump right in. My first question is for everybody. COVID-19 has profoundly impacted pretty much every industry, but most especially healthcare. Could you all share the single biggest way that your own job has changed since March? Anthony, let's start with you.
Thank you so much. So obviously, like many folks in a leadership position, our responsibilities and how we serve and deliver healthcare to our patients had to be completely reimagined. The main thing for us, one of the largest changes, was we had to be able to develop a pre-order avenue for our patients. So the majority of our business was walk-in business. We didn't do very many pre-order, online ordering. And then when COVID happened, the Maryland Cannabis Commission allowed for curbside delivery, or basically to allow us to serve our patients in their vehicles. We really had to bridge that gap of the patient experience that they were receiving when they were coming in and meeting with our patient consultants and having that face-to-face contact versus us just going to their vehicle. It forced us to really digitize a lot of our content and really try to digitize our patient experience to deliver it online to our patients and try to fill that gap without really being able to have those same face-to-face interactions that we prided ourselves on in the beginning.
Michael?
A few things that really changed for us at CareFirst. First and foremost, as with everybody here, we're now working from a virtual environment. So having the right tools and collaboration infrastructure to be successful working internally and externally has been a change. At the very beginning of the pandemic, we've also had to think about and revamp some of our policies to ensure that we continue to maintain access to things like telemedicine for members in our community. And we continue to evaluate and update policies as those things have evolved and as the situation has evolved. And then I think the third thing, probably the biggest thing to your question, at the very beginning of this pandemic, we were beginning to make motion into Medicaid and Medicare Advantage markets, populations that are incredibly impacted by the current pandemic. And so the whole situation has just reinforced our interest and our desire to be in those markets so that we can provide value and support those memberships. So since the pandemic has been going on, we have finalized transactions to be present in the Medicaid markets and stood up our Medicare Advantage offerings. And we look forward to being able to serve those populations, knowing that they are receiving some of the brunt of the issues right now with everything going
on. Jane?
So the University of Maryland School of Nursing has over 2,000 students in our entry-level programs as well as our graduate programs. And so in mid-March, we went to total virtual delivery of our didactic component of the coursework. And then we work closely with our clinical partners to continue to have students in the clinical environments as safely as possible, as well as greater use of simulation in terms of having students learn through simulated learning experiences where we could enhance their safety through physical distancing as well as all the appropriate PPE. So it did require a really heavy lift in terms of the faculty to sort of turn what had been a historical delivered in the seat programs to virtual delivery. So a massive lift both in the Baltimore campus and at the universities at Shady Grove where we have students as well.
And Jonathan?
Yeah, like many have said already, the delivery of healthcare changed dramatically. And so everything we did at LifeBridge Health has really pivoted and changed. Personally, in terms of the way my work changed, I was suddenly leveraging all the things that I had been working on with telemedicine and with the virtual hospital and our clinical call centers in Israel and the Philippines and shifting all that focus onto screening and testing. And so we stood up one of the first drive-through testing sites in the state of Maryland and had massive demand, as you can imagine, from the very beginning. So it was, despite the fact that it was a scary time, it was a very exciting time to be working in something brand new. And we were literally studying Chick-fil-A and other modalities of drive-through so we could accommodate thousands and thousands of daily requests for testing. So we went into a new business, if you will, a whole new avenue of this drive-through clinical care model. And we leveraged a lot of what we had built before in telemedicine and the call centers towards that end. But ultimately, it was still a very new business and something very exciting and good for serving the communities around our hospitals.
Okay. And Jonathan, I'm going to stay with you for a minute because among the innovation trends we've seen come out of the pandemic, you mentioned the growth in telemedicine. to help give the audience some context, talk a little bit about what the virtual hospital at LifeBridge looked like back in January and February, how it operated, and then how it looks now.
Sure. So a lot of things have changed, and in very different ways. One thing is that we actually had a virtual hospital, a physical presence on the Sinai campus of LifeBridge Health, and in that hospital we had nurses, we had MAs and other staff members, registration people, as well as PAs and doctors doing clinical care using telemedicine. So all of that has been virtualized, which was a big change, as many of our workforce has been virtualized, and our volumes dramatically changed as well. So we used to be proud of the fact that we were hitting about 1,500 telehealth visits a month, which we thought was pretty good for our needs, and we dramatically grew that. And at our peak, we were doing about 1,000 telehealth visits a day. So in the last 6 months, we've done over 120,000 telehealth visits, and that was a huge, that was a massive change and uptick of our volume. At the same time, we virtualized all of our staff, so now we have staff not all centralized in the virtual hospital building, which we were before, but all at home in various places. So coordinating all that from a technological and logistics point of view was challenging. And so the virtual hospital has shifted to serve COVID and all the ramifications of COVID, not just COVID patients like we do when we do video visits for follow-up after someone's positive with COVID, or we do remote patient monitoring on people who are positive by checking in with them every day for 14 or 16 days. Not only do we do that related to COVID directly, but we do an enormous amount of primary care visits and specialty visits by telemedicine that otherwise would have been done by in-person visits. So in all those ways, we've shifted, we've grown, and we've adapted to the new environment we're in.
And you and I have talked before about how the growth in telemedicine is probably going to be sustained. We're going to see a lot of telemedicine into the future. Can you talk about some of the biggest advantages of telemedicine and also some of the limitations?
Sure. I certainly think a lot of the advances and progress we made is going to stay. I think we've probably already seen most of the adjustment. So like I said, we were doing, in terms of primary care visits, we were doing about 10 a month before. Most of our telemedicine was other use cases. That grew to about 800 a month, 900 a month primary care visits. That was the bulk of our telemedicine visits, actually. And that settled back down, and we plot all the data. It's a nice leveling off at about 350 to 400 visits a month. And that's where we've been for the last 4 or 5 months. And I think we're probably going to stay somewhere around that. So it's about 15% of our volume now has stuck with telemedicine. The reasons for that, besides for the improvement in reimbursement, are largely the hurdles of the patient and the providers for overcoming the new technology and adjusting to the new delivery models. So for many, many things, it's a very viable option. Clearly for an abdominal exam or for certain types of exams and care, you can't do it by telemedicine, and those will remain in person, indefinitely. But for many things, it's so much more convenient, it's so much more cost effective. And now that people have grown accustomed to it and are used to it and comfortable with it, I think that we're going to stay at about a quarter of our peak indefinitely. And I think that's going to be, a whole new type of method of delivery of care that we're really embracing. And we were, scratching at the surface for a couple years before that. But now that everyone is all in and jumped right in and adapted because of necessity, I think we're going to stay with a lot of telemedicine into the future.
Okay. And Jane, I know the nursing school responded to the immediate need we saw for more healthcare workers during the pandemic in a pretty unique way. Can you talk a little bit about what you guys did?
So actually, we have May and December graduates from our entry into practice programs, both our baccalaureate and our clinical nurse leader master's program. And on the request of the governor and the Secretary of Health, last May, we did an early exit program in which students who had met the requirements for the program were able to leave prior to graduation and enter the workforce as nursing graduates recognized by the Maryland Board of Nursing. This helped with the demand for additional providers in the spring when COVID first came to the United States. And we've just announced this week that we're actually doing early exit for our December graduates as well. And they will be exiting as of Monday through December 2nd. And our hope is that many of them will work with the health systems who have indicated an interest in hiring them sooner than the normal patterns, because we know that there is a shortage of nurses in the workforce in caring during pandemic, with tremendous demands for nurses with intensive care experience. So nurses who are working, say, in a medical, surgical, or an adult health unit, many are being pulled into intensive care to meet the needs of the most sickest. And so we're trying to provide additional hands and heads and hearts and souls for the folks who are hiring, so that we can meet the needs as the pandemic continues to surge in Maryland, but also in the United States and across the world. So we're proud of our students who have been resilient and who have been willing to step into the space. And the early exit option is one of the ways that we can help. Our colleagues at Towson are also doing likewise with their baccalaureate graduates.
And we had heard about the shortage of nurses for even before COVID-19 hit. And I wanted to talk with you about how your school is aiming to close that gap and get more nurses in the field. And also, do you expect that COVID-19 and kind of the fears and fatigue swirling around the pandemic will make it harder to motivate people to become nurses?
Yeah, so, nursing is the largest health profession in the United States with over 3.5 million nurses. And we as a discipline have gone through shortages on cyclical bases. And most of the time they've been either a supply problem or a demand problem. But what we know now for the last decade is it's actually both, because nursing is a growth industry. If you look at the labor force statistics, it's the number who are retiring. We're trying to replace them and also build the workforce. So at Maryland, we're really pleased. We've been able to increase our enrollments in our entry-level programs. And our current place that we're focused on is actually at the universities at Shady Grove and Rockville, where we're going from admitting 64 students each semester up to 100. So we are trying to grow the enrollment in response to the needs for Maryland, because most of the Maryland nurses who graduate from the University of Maryland School of Nursing stay local or stay in the region. So we are one of the big providers of that new workforce. In addition, we've opened a family nurse practitioner program at the universities at Shady Grove, in addition to Baltimore, because primary care needs are pretty important in terms of people being able to do the right preventative care that they need to do to stay well. So we continue to look at those opportunities and try to respond to the needs of the state. It's in terms of, we kind of hold our breath about enrollment in terms of making sure that we still have a pipeline, but I'm pleased to say that the folks who are interested in nursing remain strong. After 9/11, we saw a tremendous influx of individuals who were second careers, who said they wanted to be in the caring business. And my hope is that we'll continue to see demand for nursing in terms of interest in it as we continue through the pandemic, because it is one of those places where you make a good wage, a very livable wage, but you also have tremendous flexibility, because what you start out doing in nursing doesn't mean that's what you're going to finish doing, and you probably will change what you do 4 or 5 times. So I keep my fingers crossed that we can continue to have people who are interested, so that we can in fact meet the workforce needs for Maryland and the region.
Okay. Michael, next I want to talk with you and talk a little bit about CareFirst, and specifically what you guys are doing in kind of the innovation and promoting health technologies space. Last year, CareFirst partnered with LifeBridge to host a funding pitch competition for digital health startups. And it was announced during that pitch competition that you guys are also working on an incubator for startups. Why was that partnership something that CareFirst wanted to participate in? And can you give us an idea of where things are going with the future of investments in the incubator?
Certainly. First and foremost, we're incredibly excited about the CareFirst LifeBridge partnership on the incubation program. It's good to see you, Dr. Thierman. Glad to have someone from LifeBridge on the panel here as well. I think the answer to your question, Morgan, is really in two spaces. Why working with LifeBridge, and then why focusing on incubating early stage companies. To start on the first piece, a phrase that we often throw around, I know many do, is that care is local. And so it's always important for CareFirst to be fostering important, strong relationships with our local provider systems who are at the front line of care and finding better ways for us to participate and support that care delivery. I think about the fact that for many years, the BCMH program was sort of our hallmark program and how we did that. And today we're rethinking and evaluating how we continue to evolve that, again, support of our providers. So working with LifeBridge, through the specific partnership, not only gave us a chance to work on the specific program, but from both sides allowed us to increase the dialogue on other ways that we might be actually supporting each other, give us a chance to learn more about what's happening at the front line. And I know beyond this program, specifically giving us an access and opportunity to try some things beyond what we typically might do with our provider systems. And I think some of those other programs might be coming to light, might be announced in the coming year. But shifting to your question on specifically the incubator program, we think about that range of companies that are looking to create, grow, and ultimately scale their new companies, their businesses, their solutions in healthcare. And from the HealthWorx team's perspective within CareFirst, we implement different strategies at different points in that process or different points in that spectrum. We wanted to create a program around the support of the earliest phase of those companies. So we knew that at that point in time, those companies are often not in a position to work with CareFirst or to engage directly. So the incubator program gives us a vehicle by which we can support those earliest nascent companies who are starting to build their business models. Now, one thing that we see a lot when we do talk to companies today is companies that have recognized one piece of the healthcare ecosystem, the stakeholders in healthcare, whether that's the payer or the provider, maybe others, but don't always have a business model that stitches together in the right way the relationships between those different stakeholders. And so by having a relationship with LifeBridge, by combining our resources and collaborating on this program, we can offer what we think is a differentiated approach to incubating these early stage companies, where we can give them access and insight from both sides of the coin, from the payer perspective, from the provider perspective, and ideally help them become more successful as a result of that. LifeBridge has had success with their bioincubator program, and so they've been a great partner bringing some of that subject matter expertise on how you do that fostering of early stage companies to the table. And we've also evolved our program since we talked a little bit about it last year to try to do even more in support of these companies. So now, in addition to having the incubator program, the educational resources, we're now looking at investing up to $100,000 per company that enters the program, that meets their milestones. That's just another way to sort of reinforce our commitment to the early stage healthcare ecosystem. We are, as you could guess, because of the pandemic, updating our approach to deploying that program. There are going to be likely some remote components, more so than we would have originally expected, but we are planning to launch that program next year under the heading of 1501 Health. I think that was announced recently. And so there should be more coming out about that soon. But we're really excited to continue moving forward on that program in the coming year.
Okay. And can you give us an idea of some of the investments and technologies HealthWorx might have been involved with this year and their potential value? And do any of them have implications for what we're currently going through with COVID?
Certainly. Two that come to mind. First and foremost, we went back to many of our existing investments or partners when COVID became more and more prevalent and started to look at what we might do with those existing relationships in the context of the current pandemic. One partnership that certainly led to some high value programs is with Socially Determined, a social determinants of health data analytics company based in DC. So we're currently an investor in Socially Determined, and working with them, we were able to develop a vulnerability index, which helped us to identify which populations within our communities, in Maryland specifically, are most at risk as a result of the COVID pandemic, or are most susceptible to having the effects of COVID. And so that gave us a program where we could be a little bit more tactical, where we might target support or resources in response to the growing situation. A second space I'll point to that we've been excited about and that we'll have more coming out next year is thinking about where the greatest needs are from the perspective of our employers. So right at the beginning of this year, my team, our commercialization team, was actually digging deep into broad problems within healthcare throughout the market. And a number of things that came to light were things that employers were looking for to better support their employees. And one of those things was support for working caregivers. So to define that term a little bit, working caregivers would be anybody who is an employee who is providing support to a loved one, family, or friend who's aging, ill, or disabled. Now, we identified that as an interesting space right before the pandemic. A few months into the pandemic, we were reevaluating what we wanted to focus on. And that item just jumped from sort of in the middle of the areas of priority to number one. It became apparent that this is a hot topic right now. Employers are realizing that as their employees work from home, their role as a caregiver only becomes more acute, more heightened, and solutions in that space today, largely tied to EAP or employee assistance programs, can be often very episodic, so just sort of point-in-time solutions, or might just be financial. It might give some sort of financial support to working caregivers. We identified that there was a need for more holistic solutions in that space, and so we're excited to announce first that we did a lot of research over the summer, talking to caregivers, talking to employers, and we'll be coming out with a white paper summarizing our research in this market that really focuses in on the experience points of caregiving, where we think there's better opportunities for support. And even more importantly, next year we'll be coming out with an actual solution to support working caregivers. So this is a solution that CareFirst or our HealthWorx team is building ourselves, and it'll be a combination technology and service platform that we're excited to bring to our employers and employers outside our region as well, again, at some point in 2021. So SDOH and caregiving are two spaces we focused on this year, in part because of the pandemic.
Okay. And Anthony, we're going to move to kind of a relatively newer aspect of healthcare in Maryland. The cannabis industry has been going now for a couple years, and we've seen huge growth. What are some of the challenges of building a business in an industry that we know still has a lot of stigma attached to it? And can you talk a little bit about that stigma and kind of how it plays into your business and how, if at all, you've seen it lessen over the years that we've been getting more familiar with the drug?
Yeah, thank you for the opportunity. I'm optimistic and think that we have seen a dissipation of the negative stigma around medical cannabis. And I think when you look at the stigma issue, I think it honestly is played into two different bases. It becomes the perception and kind of the anecdotal feeling of stigma around medical cannabis, and also the federal landscape, which still allows it to be federally illegal, which even when the stigma is not necessarily there, the red tape and bureaucracy and the burdens don't necessarily allow traditional medical healthcare providers that we have on the panel with us today to participate. So to address the stigma piece, I feel that over the last 3 years, December 6th, we'll celebrate our third anniversary, and we were one of the first dispensaries open in the state. I think the anecdotal evidence there that this is actually something that can be helpful is growing as we're seeing more and more providers refer patients to us. In the beginning, that wasn't so the case. I think there was a lot of trust building and our ability to deliver on what we said we were going to do with our model to build that acceptance from practitioners to feel that when they send somebody to us, it would be like they were being sent to a pharmacy, or like they were being sent to a specialty provider, not, quite frankly, like Cheech and Chong's head shop. And it was really important for us that we piggybacked off of that medical basis for everything that we did, so that providers would, it would be easier for providers to refer patients to us, but then also for the patients that were new to medical cannabis, that were THC naive, we wanted to make sure that they felt welcome as well. And that was a big piece of breaking the stigma, was making sure that that patient experience for our patients was very medical centric and based around understanding that not everyone was excited to be in our facility. Not everyone thought it was a great thing that they got their medical card. As a matter of fact, especially in the beginning with a much older patient population, in the beginning, a lot of our patients, it was their last chance kind of at trying to address a symptom or a problem or to create a health outcome. They had been down several other routes as well and kind of at the end of their rope. And those were the patients that we really wanted to connect with and really try to work with, because we knew that they would go back and tell their physicians that they had a really positive experience. We knew they would go out and tell the community leaders that, hey, this is something that has value in our community. This is something that is good.
And I know you've taken a unique approach to building your dispensary business in Salisbury. Can you talk about how and why you're aiming to combine what you do with other kinds of health and wellness services?
Sure. So we opened up our dispensary, and we were really just that. We were really just a cannabis pharmacy. Patients were coming to us with a laundry list of medical issues, prescription lists that were 3 pages long, and not really interested in changing doing any type of behavioral modifications. They just wanted to know which strain was going to heal them and suddenly make all of their issues go away. And we really had to get into the business of expectation setting, and letting our patients know that, look, cannabis is a tool just like you have at your pharmacy and just like you find other places. However, it's not the only tool, and a lot of the best ways for you to get the health outcomes that you're going to need are going to be through behavioral modifications, are going to be through an holistic approach. So I looked at Cancer Center Treatment of America. I looked at the Mayo Clinic, where they took a model and brought a variety of subject matter experts, a variety of different principals and practitioners to one place to provide kind of a one-stop shop for the patients. So for me, when we built our new campus, it was very important that, yes, we have a dispensary, but that's less than 25% of our total square footage and less than 25% of our total offerings. We have a space for small exercise groups and yoga. We work with mental health care professionals. We work with different practitioners. And then, of course, we are based by our clinical director, Dr. Mary Pat Hoffman, who's a PharmD and is the linchpin of a lot of what we do with our complex cases, and being able to really understand and navigate through the practitioners' understanding and kind of what their background is and how they're coming to the table, and then also what is best with our business, and kind of merge them together. Because in the beginning, it was almost this, we're going to take on the world, because we didn't have a lot of collaboration. We didn't have a lot of help. We kind of had to go do it on our own. But we realized very quickly that wasn't the optimal way to create these health outcomes. And our patients need oftentimes prescriptions. They oftentimes need some supplements. They oftentimes need exercise. They need providers. They need all of it when the cases are very complex. And that's what we wanted to obtain. And it's been a challenge with COVID necessarily to have all the community building that we were looking to do. But through telemedicine, we implemented a practice management software 6 months ago when COVID happened, and we've been doing telehealth appointments. We've been serving as that catalyst and linking in practitioners. And I think one of the biggest benefits of this coming to light, and like many of us are finding on the call, you're presented with opportunities that you may not have explored in the same priority as we are now. And that's unfortunately, and maybe Maryland has only had a program for 3 years. So there are very knowledgeable health practitioners and professionals in the cannabinoid-based medicine space that are outside of our area. And pre-COVID, it was really tough and challenging necessarily to link our patients to those folks. But now with telemedicine, if we have, for instance, a breast cancer specialist in California that I want to link up with a patient, now it's a simple, link where we're hopping in on a telehealth conference meeting and bringing everyone to the table. So the model itself and bringing everyone together was validated early in our model that we needed that. And then through COVID, now we've just had to adapt how we bring that to life.
Okay. And I'm going to go back to a group question for this next one. We know workers in many industries, but most especially in healthcare, are facing serious COVID fatigue at this stage. What can organizations in your various industry spaces do to support workers as we get ready for what is looking like another big surge of COVID? And what are some of your own coping strategies that you guys have adopted? Anthony, we'll start with you.
I think for me and my staff, as we experienced our first COVID positive case of an employee a couple weeks ago, it was really about being honest and transparent, but also setting table stakes of the fact that we're in a pandemic. Like these aren't normal times, and there's not a lot of writing on the wall that shows us that this is going to be improving anytime soon. And I honestly just had a very I just told them this is going to stink. We are essential workers. We are healthcare providers. Our patients depend on us. We have to take care of ourselves first and foremost and practice what we preach. We are a wellness facility. We practice healthy diet. We practice exercise. We practice mindfulness and breathing and de-stressing and taking care of yourself, because you can't take care of others if you're not taking care of yourself. And it's really important that we don't just make these platitudes, but that we're actually, we've tried to do different things throughout the days to give our employees more breaks, to try and lighten the load when we can. But I think it's just important to understand that there's no silver bullet here. That this is when times get tough. You get to see who will really rise to the top, and we've seen some employees who I would imagine, if this goes on for another 9 or 12 months, may not be in this industry for a long time, because it has changed so much, and it has gotten so much harder with COVID to be able to deliver the healthcare that we would set out to do.
Michael?
Sure. So I think across the organization, any organization, ours or others, being cognizant about the tools that employees need to be successful in their role, whether that's collaboration tools or infrastructure for their home office. I know we've been making an effort to provide some resources to employees to give them a chance to recruit some of the tools they may not have normally had at home to be effective in their role. It's also a mindset and being really cognizant about the behavioral and mental health needs of your employees. Anthony mentioned a little bit about this, but creating time and space to have mental breaks. I know on many teams there's been implementation of taking 12 to 1 as a lunch break and reinforcing that, so that you have a moment in time where you can relax and come back to work focused and attentive. I mentioned a need around working caregivers. It's sort of a tactical project we're working on, but I would say for organizations in general, recognize that your employees are doing more than just their job at home, and that ends up putting more stress on them. That there are sometimes ways you can actually support that, whether it's through benefits or other tactics. And then I think on an individual level, doing your part, wearing and asking your employees to do their part, wear their masks, be cognizant of the neighborhoods and the communities they're engaging with. And then the bottom line, and probably the most important one, follow the regulations that those with knowledge have put out there for us, and allow us to sort of tackle this challenge as a community, working together in following those directions.
Jane?
So the University of Maryland, Baltimore president, Gerald, is really deeply committed to keeping as many of its employees teleworking during the pandemic and reducing the risk of being on the campuses, whether it's at Shady Grove or in Baltimore. And so they've been very transparent in terms of letting folks know that we will continue to telework, the majority of us. We also are strongly encouraged to do all of the practices that are recommended in terms of reducing the risk for those around us. We also have been working closely with our students because they are faced with numerous issues, whether they're mental health issues, whether they're financial issues, whether they themselves become COVID positive and they have to step out of their programs of study for a period of time. We established an emergency aid fund so that students who really are pushed financially can request additional support, whether that be for food, it might be to cover housing because their significant other has lost their work. So we really have taken a multiple-pronged approach to trying to support folks. We've done some really practical things, like Wednesday is meeting free in the School of Nursing, so that people can sort of take a breather and work on their work versus work on WebExes. And simple things like starting meetings at 5 after the hour, or just so that we get up and we call it 5 at 5 so we can stretch. We also do weekly town halls that I hold with the faculty and staff, and I get about 150 of folks are there, and we just do those in order to stay connected, but more importantly to answer questions, because there's a lot of concern that the university will go on furloughs or will be laying off people, and we've made a commitment to not do that through this academic year. And so it's just really reassuring people, because I think this uncertainty wears at people as they juggle the multiple responsibilities. And And like others on the phone, we fully recognize that people are juggling multiple things. So we have a Family First campaign, and we say, whoever your family is, it's your definition, but they need to come first now as we sort of navigate the surge of the pandemic. So lots of different strategies, but trying to stay connected and trying to stay transparent and try to reassure folks that their jobs are secure.
And Jonathan?
Yeah, we've done many of the same things that Jane mentioned at our health institution. We've encouraged telecommuting and made that easier and more viable. Mostly, I think that we focus on protecting our staff and our providers, and through some big initiatives, we've really tried to protect them and show them that the hospital is a safe place to be. We do have a lot of staff that have actually come down COVID positive, but it's because we have a lot of staff. 13,000 employees. So we've had hundreds of staff members, but the vast majority of them actually have contracted COVID outside of the facilities, not within our facilities. So we've worked really hard to make sure that being at LifeBridge Health is actually safer in some ways than not being at LifeBridge Health by showing everyone how much we are going to work to protect them. So one thing that we've done is stood up a massive PPE manufacturing process where we were making tens of thousands of face shields and masks homemade during the early days of the pandemic when that stuff was scarce and hard to come by and people were being asked to reuse and things like that. We were redeploying a lot of our staff. In terms of furloughing, we really made every effort, and me in the virtual hospital, we hired 40 or 50 people from other fields to make sure they weren't out of work. We hired them in the virtual hospital to shift efforts. And likewise, we hired dozens and dozens, hundreds of people really to work on making PPE for the rest of the frontline staff so that they'd be safe. And then finally, personally, I'm an ER physician, and even though I was called, and I still practice, but I was called out of that to really man the testing and the operations. I feel it's my personal mission to keep the positive patients away from my colleagues and away from the hospital if they don't need to be there. So my goal has been to make testing so accessible and so easy that no one should walk into an ER simply because they want to test when they could have been at a drive-through, and therefore much safer for all the other patients in the waiting room and for the providers and nurses on the front lines. So, I've made every effort to try and claim those patients as my patients so that we can test them outside the facilities in a safer way rather than letting them be in the facilities where they might infect other patients or staff. So through all those mechanisms, we've been mostly focused on protecting our providers, which we think will reduce stress. And then finally, we've been, of course, acknowledging that this is a stressful time, and we've had guest speakers who've talked about physician and provider burnout and nursing burnout and other areas that are, apropos to this unique time. And so we've had some town halls and things like that to try and address those issues.
Okay. And I want to leave things on a positive note. So I'm going to ask you all, what is something you are most hopeful about or most looking forward to seeing in the field in the next few months? Anthony, we'll start with you again.
I think the thing I'm most hopeful about is just further validation that during these times of unprecedented stress and anxiety, depression, and we even see different forms of addiction at a rocket, we prove to be on the good side of things, and we prove to be a good steward, or basically a good tool for the community to help combat some of those things. And even with the change of our model now, our patient base is still growing at an all-time high, and we're seeing more and more patients look to alternative forms of medicine and holistic forms of medicine and natural ways to improve their health. And that makes me excited to see that different levels of awakening drive patients to us. And I don't think that that's going to slow down. I think this pandemic has just created a greater level of awareness for that.
Michael?
First, I think I'll reinforce three things that we're really excited for in 2021. The launch of the 1501 health program with our LifeBridge partners, the launch of our solution for working caregivers, that'll be coming, more information will be coming out soon through the white paper. And three is our ability to participate in government programs, Medicaid and Medicare Advantage. Another partnership that just was announced in the last couple of weeks or so was with City Block Health, which in the district is helping us support that underserved population And I think we'll be finding more programs and opportunities to target those members in 2021. More broadly, I'd say there's no doubt 2020 has been a challenge for all healthcare industry members and otherwise. But on the positive note you mentioned, I think it creates a lot of new opportunities, whether from organizations like those represented here, incumbents in the ecosystem, to new companies, entrepreneurs who are looking to bring solutions to market and recognizing that we now face new challenges that we're certainly looking for partners to help us solve. And so I think some of those new solutions that we don't even have a vision into what those might be yet, but because there's new challenges, there's new problems to be solved, I think we're looking forward to seeing what that might look like alongside those programs I mentioned next year.
Jane?
So my hope over the next few months is that we have readily accessible vaccinations that can help us to turn the curve here, that we continue to have the supply of PPE we need in terms of for the frontline providers who are caring deeply and very carefully for the people that are there and need their care. And my other hope is that when we come out the other side, that we're going to be different and we take the lessons that we've learned through this process and we use them to really transform not only education, but healthcare delivery. And while we may not have chosen to get here this way, there are lessons to be learned, and we need to use this opportunity to continue to refine the work that we do.
Jonathan?
Yeah, I'm also extremely hopeful and optimistic about a vaccine. I'm excited and have been thinking for a few months about the fact that we are going to pivot all of our drive-through and walk-up testing sites to vaccination sites, I hope, and use the same types of technologies that have enabled us to have high-throughput testing to have high-throughput vaccinations when those become readily available. So I'm very optimistic. I think 2021 is going to be a lot of good vaccinations of people rather than a lot of good testing of people and telling them they have COVID. I'm also excited about the changes we've made. We've learned to adapt and to use technology to become very efficient. Our call center, for example, at the peak of COVID was getting about 1,500 phone calls a day, and we had about 40 nurses manning the phones and 10 or 12 PAs. Now we're getting, unfortunately, in the last week, the same volume of phone calls, but over the summer, we deployed so many technologies to help. We are down to 6 nurses and 2 PAs. So we have a tiny fraction of the workforce doing the exact same amount of work. And so that's through technology that's enabled us. And I hope that those technologies will carry over, like telehealth and some of the other systems. And finally, through those technologies, we've been reaching patients in the community we were not reaching before. So we have a mobile health clinic that's going out in a van around Baltimore and serving communities. We do telehealth with the van and reaching patients that even before COVID would never make it into the hospital because of transportation issues or other issues. So I'm hopeful that a lot of the advances we've made to serve the communities will carry over and help us serve them better, even after COVID is just a distant memory and something we all remember in the past and not present.
Okay. Thank you all. We're going to end it there. 2020 has put us all through a lot, but I'm glad to have you guys all in our corner as consumers. And I hope to continue to write about all the exciting things you guys are doing. Thank you so much.
Thank you.
Thank you.
Thanks.
Thank you all.
And now I'll send it back to Rhonda.
Thank you, Morgan, and our knowledgeable panelists for sharing your insight and experiences within the healthcare industry with us all today. Thank you to premier sponsor RCM&D, partner sponsor CastCon, and other contributing sponsors. Congratulations again to all of our honorees and to all of you that are on the front lines of this pandemic, either in the hospital or supporting those who are. Thank you. That concludes the Baltimore Business Journal's Leaders in Healthcare Awards and discussion. Thank you for joining us and enjoy the rest of your day.